A 67-year-old man with a 40-pack year smoking history comes to the clinic because of worsening shortness of breath and leg swelling for 3 months. He reports frequent coughing and occasional sputum production. Vital signs show blood pressure of 128 over 78 millimeters mercury, pulse 92 per minute, respirations 20 per minute, and oxygen saturation of 88% on room air. Physical examination shows elevated jugular venous pressure, hepatomegaly, and bilateral pitting edema to his knees. Lung auscultation reveals diffuse wheezes. Chest x-ray shows hyperinflated lungs with a flattened diaphragm. Echocardiography demonstrates right ventricular dilation with impaired function. Laboratory studies show an elevated serum brain natriuretic peptide concentration. Which of the following is most likely increased in this patient's kidneys? Choice A, tyrosine kinase. Choice B, phosphodiesterase. Choice C, protein kinase A. Choice D, protein kinase C. Or choice E, protein kinase G. I'll wait 5 seconds and then answer the question. Some of you who are very good with your signaling pathways will instantly spot that this question is a bit unfair. Let me just say ahead of time that this is based off of an MBME question, but let's just get into the clinical picture first and we'll deal with that later. So this patient has a cor pulmonale due to long-standing COPD. That should not be hard to spot for most of you. So those of you who are a little confused, a cor pulmonale is basically heart disease that results from a lung disease. So what happens is that in long-standing lung disease, like a long-term COPD, the increased pressure can eventually lead to a pulmonary hypertension, and you will end up with a right-sided heart failure, which will lead to a right-sided ventricular hypertrophy. And that's also what leads to the things you see here. You'll have a JVD, you'll have hepatomegaly, you'll have edema, and that's because all the blood is backing up into the venous system, right? And obviously in this case, we can tell you has COPD, we gave the buzzy findings, hyperinflated lungs, flattened diaphragm. Shouldn't be a hard diagnosis there. So the question explicitly tells you that his serum BNP, brain natriuretic peptide, is increased. And then all the answer choices are about the signaling pathway. And of course, those of you who are familiar with your signaling pathways will know that natriuretic peptide acts on natriuretic peptide receptors, which increase cGMP, and then that of course increases choice E, protein kinase G, downstream. So really, this question could have just said, which of the following is activated downstream by brain natriuretic peptide, and would have been the same question. But obviously this clinical picture might have confused some of you. So let's just run down the answer choices, okay? Choice A, tyrosine kinase. As far as hormone signaling goes, the most relevant thing to talk about with tyrosine kinase is insulin. You have a couple of growth factors like IGF-1, EGF, etc. They also signal on tyrosine kinase, but insulin is probably the important one for USMLE. Tyrosine kinase doesn't come up as in like these sort of receptor questions that often. It's more often that when we think tyrosine kinase, we're probably thinking of something like CML, right? With the Philadelphia chromosome, BCR, ABL protein, fusion protein for tyrosine kinase, and you treat it with imatinib. Obviously not really related here, I just felt the need to point it out because that's probably the thing a lot of people think of when you think tyrosine kinase. Moving on, choice B, phosphodiesterase is pretty much a distractor. Phosphodiesterase degrades cyclic nucleotides like cGMP, so that would have the opposite effect in this patient. This was also a distractor on a similar question on an MBME, so they probably expected some students to pick this because they get confused and they remember phosphodiesterase inhibitors like sildenafil, which is Viagra, which increase cGMP, but obviously that's the opposite. That's an inhibitor of phosphodiesterase. So opposite of what this is. Wrong answer. So now, of course, we come to the most annoying part of signal pathways, which is the G-coupled receptors and all these protein kinases. You got protein kinase A, protein kinase C, protein kinase G. There's nothing I can tell you other than that you need to have these memorized. Protein kinase A, choice C, of course, is related to the GS receptor, which activates CAMP, and then that activates protein kinase A downstream. As far as hormones that increase intracellular CAMP, that includes a lot of peptide hormones, FSH, LH, ACTH, TSH, CRH, PTH, calcitonin, glucagon. These are all really important. You got to know that these signal to GS protein or increase CAMP. Now, it's more often that they'll instead go for big picture and they instead test you on which of these are intracellular versus extracellular signaling, because the intracellular ones are obviously the steroid hormones, right? But they do occasionally do these questions where They want you to specifically know that certain ones increase CAMP. Anyway, these hormones are largely unrelated here. I think what trips a lot of people up here is choice D, protein kinase C. Now, protein kinase C is largely from GQ receptors, right? GQ receptors cleaves PIP2 into IP3 and diacylglycerol, which downstream will activate protein kinase C, also causes intracellular calcium release. And the hormones that cause this release include GnRH, gastrin, oxytocin, TRH, ADH, histamine, angiotensin 2. Most relevantly here, a lot of you are gonna bring up that, wait, this guy has cor pulmonale, so reasonably couldn't we assume that he has an increase in ADH, he has an increase in his ROS, and therefore an increase in angiotensin 2? Why would choice D not be a correct answer? And I agree with you. But the MBME question I based this off of is very similar in that they straight up ask you about brain natriuretic peptide in the setting of something that you could reasonably assume activates ADH or the ROS system, and they have a wrong answer in there that is also along the GQ pathway. And the correct answer was in the CGMP pathway. Now, we can sit here and discuss it, we can argue about it, we can say that maybe it's an erratum, but at the end of the day, it is on the MBME, and we can't argue too much with the MBME sometimes. So the main takeaway I would assume you would have here is that, yes, I do want to teach you the concept here, but also recognize that MBME sometimes gives you questions where it's like, what it feels like you have an answer choice that could also be right, but I guess you have to stick to what the question was really feeding you, which is they're emphasizing the B and P here, and you're not supposed to go off and think about the RAS system or ADH. It's stupid. It feels like the question is punishing you for knowing too much. But again, at some point, we can't argue against the MBMEs. So once again, the main takeaway here is that know which signals your hormones activate. And of course, BNP doesn't come up as often, which ones it activates, but just know that it participates in the guanylyl cyclase pathway, which activates CGMP and then activates protein kinase G. You got to know all the pathways for these G proteins, okay? You can't be lazy about it. I hope this question was helpful for you. I'll see you in the next one.